So as part of a follow-up conversation from our third working group meeting, we have Julie here that wanted to share some thoughts, comments, feedback, both around patient education and provider education in the work that she does. So we obviously wanted to make sure that we had this conversation, did it in a transparent way. So we have this call, and Julie, I'll hand it over to you. And as you give us your thoughts and feedbacks, I'm sure I'll have some questions, and maybe we can come to next steps with some of the topics that you're speaking of or talking to.
Okay, yeah. Well, the question was posed about, patient education in the process of getting their medical certifications and how that education happens. And so my comment was that there doesn't seem to be a consistent sort of way of having that happen with people who are writing the medical certification cards. And I wondered if some sort of a template or worksheet could be developed that could be given to patients. Every patient that gets a medical certification should get something, relatively similar. What are the risks and benefits of the medicinal cannabis? And, some of the rules around being a medical patient in the state of Maine, some of the expectations of the patient, as well as what they should expect of their prescriber. And that should also give the patient, the prescribers, contact information so that they can have further education if they need it. And so, some sort of a uniform education process should be developed so that the patients aren't getting a card from one person and getting a lot of education and getting it from another person and really not getting any. And I do hear testimony every day from patients who I'm writing certification cards for that they've had very inconsistent sort of processes of getting their cards in the past. So we'd like to see something uniform happen with that.
Yeah, so I guess I have two questions there. One, are you proposing some type of fact sheet or document or leaflet developed by the Office of Marijuana Policy that's distributed to the providers? So when they have that interaction and the certification is given to the patient, that they also hand over those materials, just some resources for the patients?
Yeah, that's a terrific idea, something that could be developed. And I don't know whether it's through the Office of Marijuana Policy or whether there's some sort of position that could be created to be responsible for, creating the education for patients. It should be something that's accessible on the Office of Marijuana Policy website. So if the patient loses the
Yeah.
physical copy, they'll be able to, access it again. I have a 2-page sheet that I send to patients. Everyone gets their medical card, whether they do it in person or via telemedicine, they get a written handout that has a couple pages worth of just some of the bullets. And so something like that would be uniform, that, that's been vetted and made sure that it's accurate and appropriate for patients. And it can be, some additional education can be done at the discretion of the provider if there's something, more specific, patient specific, but something pretty general would probably be pretty simple to mock up and would be valuable. And it's lacking in the community right now.
Is that sheet that you use something that you'd be willing to share with OMP in the work group, just to kind of have an idea of what some providers out there are doing?
Yeah, I'd be happy to share it with you. I mean, it's sort of homegrown, made up, and has been
Sure.
modified through the years with, if somebody asks a question and I say, oh, you know what, everybody ought to have that answer, then I sort of modify it. And it's specific to my company because it's my contact information and our workflow. But absolutely, I'll share it with you. I'll email it to you.
Cool. And then my second question is, I like your idea about making sure that the provider gives the patients their contact information. So in your experience with certifications that you issue to our patients or the state's patients, what level of follow-up do you have? Or is it more they come to you for certification and then you see them a year later? Or do some of them actually follow up with you with questions? And
so I absolutely have patients that follow up with me with questions. I had one just yesterday who had started using some products, had some side effects, and needed advice around how to modify their regimen to have it work better. So every patient that I write a card for is given a business card with my personal phone number on it, and they can call me if they have questions. They've got my email address. And I have a physical location in Augusta where they can come and have an in-person consult, which often patients can do. But it's not every patient for sure.
Right, right.
We do have to do at least once a year check in with people and do their recertifications, and that's a really good opportunity for us to review their medication list. How is the cannabis working for them? Are they suffering from any substance use disorders that they need some help with? Are they using nicotine or tobacco? Can we educate them a little bit about the possibility of converting from inhalation therapy to oral or tincture cannabis if they're using cannabis? We can do some health promotion things, check in with them and make sure there aren't any major changes in their health history. Especially for folks who lack primary care providers. They don't always have anyone that they can go to if they have questions or issues or need help with some of these things. And so we have some, opportunity to refer them on if they need help, or encourage them to seek out primary care if they've got, symptoms that need additional care. And that can be done via an in-person visit or via telemedicine. We have a process in place in my personal company that we send an email to every patient at the 6-month mark, just telling them, that just checking on them. Is everything going well? If you have any questions or issues, reminding them that they can call me, and it gives our contact information. I don't know that that's a uniform process, but we check in with everybody at the 6-month mark. But I think that the statute says that it has to be at least annually. So I don't know that,
Right.
I know that 6 months or even sooner. And I know, and we all know from personal experience, if you go to your primary care physician for your annual physical, they're not going to call you in 3 weeks and say, hey, how's your new foot cream going? Or are you having any further
Yeah.
issues? If there's the assumption is that if there's a problem, the patient will call you, and you just make sure that they're aware that they can call you.
Got it. So another question, just out of curiosity, when you're having those conversations and you're issuing the patient certification, does it come with the patient essentially giving you what they're seeking, what symptoms they're seeking to alleviate, and you giving suggestions? Or is it simply they have the symptoms, you give them the card, and it's they figure it out kind of on their own?
So that's another area of inconsistency. So,
Right.
Not all medical providers are experienced enough with or educated enough with medicinal cannabis to be able to offer really, really strong or reliable suggestions about what to use or how to use it. And so that's where the provider education is sort of lacking.
Right.
Not all people who are writing the medical cards are well versed in the use of cannabis to treat certain conditions. And oftentimes I'm told by patients that the patients are the providers sort of defer to the caregiver storefronts or the bud tenders at the stores to help the patient figure out what products to buy, which I think we could improve. The people that are writing the medical cards should be having enough education that they're able to at least do starting regimens and know sort of what works for what in the cannabis world. If you're writing that prescription for a medical certification, you should be well versed enough to be able to make suggestions about what the patient should try, starting doses of things and how to use them, and again, risks and benefits, just like if you're prescribing any other medication. Or at least have resources where the person can get a consult if they have something very specialized that needs to be treated. Have a list of specialists that can then further give them education about how to evolve their process.
So how would a provider go about getting that training? And two, what would essentially, if you had a list of providers that have that level of expertise for more serious cases or patients that are interested, what kind of threshold would there be, or education or training to be able to dictate who is on that list or not?
Right. So that would all have to be sort of figured out, I think,
Yeah.
Eric, because I don't know that I have a specific answer to that. I personally am able to provide, a little bit of education to patients when they're starting. If they're new to cannabis and they're using and they want to know how to get started, I have some knowledge that I can help them with, and it's sort of attained through seeking it out. I had to do a lot of searching to find education to specialize in medical cannabis, because there's not a lot of mainstream CME type of traditional education. So when I want to get more education on how to be a better emergency department provider in that role, there's all kinds of continuing education and seminars available. In the medical cannabis world, there's not as much. There are some. Dr. Sulak has a terrific program that people could use to be able to learn. and the healer program. He has a wonderful source. I've gone through that training. There are CMEs available from different states that offer education to some of their medical cannabis providers, physicians, and practitioners. And I've done some of those out of state CME education modules. There are books that people can self-educate. You can buy and read just with any other specialty. If you're an orthopedist or if you're special in ears, nose, and throat, then you have to find the continuing education every year relevant to your specialty or your subspecialty. So the onus is on the prescriber and on the provider to be able to seek that out. It would be terrific if there was a page on the Office of Marijuana Policy website that linked to some of the continuing education available. We could come up with kind of a list of programs or books or online continuing education modules that folks could access to get better education. Just some ideas.
Yeah, no, that's worth exploring. And I think if we got to that point, we could certainly connect with you to at least point us in the right direction to start investigating some of those resources, see if they fit with our program and make them available, or at least in a centralized location where the providers could easily access them for that, as you say, the continuing education.
Yeah, exactly. That would be terrific. Yeah.
Interesting. Did you have anything else on the topic that you wanted to share with patient education or provider education?
Well, so there are a couple of things in the statutes that I just, as far as the providers go and the prescribers of the cards, that I just wanted to see if we could get some clarification when we're redoing some of the terms and some of the language in the regulations. And so for one example, there's a section and it's the old statute, not the new one, but I want to make sure that this is clear. And this is under Title 22, Chapter 558C. 2.c, it talks about the need for a bona fide provider-patient relationship, which I think is very important. You have to be committed and have follow-up available with the patient and do that thorough assessment and all of the criteria that are listed to be able to have someone eligible be certified. But there's some language that says if a patient has not provided a medical provider who is the primary care provider's name and contact information, or if they don't have a primary care provider, that the person writing the certification has to conduct an in-person consultation with the patient prior to giving them a certification. I'd like to see that in-person consultation language be changed to in-person or via telemedicine, because patients in the rural state of Maine don't always have the access to get to a place where they can have an in-person consultation. And many, many people don't have access to primary care, either because they can't afford it or because there just isn't primary care available.
Yeah, you're not the first one to ever flag that language in there for us. And certainly I think we've been transparent in the fact that we fully support telemedicine, understanding just the geography of our state. So
it's really hard. A lot of people don't have transportation or
right.
can't afford transportation or don't have primary care. And so, that language that talks about a bona fide provider relationship, that's a subspecialty, being someone who writes the medical certifications. It's not a primary care role. And many patients, even who have primary care, who love their primary care provider, those primary care providers are not permitted to write the medical cards, either from the rules under which they're employed or because they're in a federally funded clinic. And so they defer to folks who subspecialize in the writing of the cards and the medical cannabis consultations. And so it doesn't have to be, a head to toe physical blood work, x-rays in order to give a medical card. And so we have to just make sure that the language doesn't suggest that we're assuming a role as a primary care provider when we're doing the medical cannabis consults to write the cards. And so when I look at another section of our statutes, this is 18-691 CMR Chapter 2, and I'm looking at F1. First line talks about conducting an assessment of the patient's medical history, including substance misuse history. If there's a way to adjust that language so it's a little bit more appropriate, instead of substance misuse, we should use substance use disorder in that section, just a little bit more enlightened language. And then the next line, number 2 in that same section, says that we have to encounter with the person and conduct a relevant physical examination occurring at a permanent location. That again is suggesting it has to be in person. So occurring at a permanent location. I think it's important for the prescribers to have a physical location, a brick and mortar permanent location where patients can return, but that assessment doesn't have to take place there. if we allow telemedicine. And then there's another bit of language down on the bottom that asks about a description of the treatment provided to the patient, including all past and current medications prescribed, including the date, type, dose, and quantity. That's a little bit excessive. So there's not going to be, the patient's not going to know how many pills they were prescribed, exactly what date and what dose. If we're assessing whether or not they have uncontrolled PTSD and anxiety, and they've been on several pharmaceutical medications in the past that have failed, and medical cannabis is working for them, it's good if we can document the names of those medicines for their record and have records that show they've tried other things. But I think it's just a little bit too specific. So if at the end of all of those subcategories, we could add the comment as appropriate, or as indicated, or as needed, that would give the physician or the prescriber just a little bit more discretion about how detailed their medical record has to be. And I know that we all understand that there's a lack of all of us in the healthcare world these days, and that, you know, time is of the essence. We don't all have an hour and a half or 2 hours to spend with each patient and each encounter. So some of these little sort of minutia that aren't really relevant, that could be streamlined, would help for patients to be able to have more, we could see more patients and have access to help more people. So as appropriate at the end of A, B, C, D, E, and F on section 5 of that same section might be an appropriate way to modify that, to make it, to keep the language that you want and the spirit of what you're looking for, but not pigeonhole folks into being trapped into making sure that they have 2 hours worth of documentation. Does that make sense?
It does. All great feedback.
Yeah. And then the other thing that I've heard from folks, from patients when I'm writing cards for them, and I see every day, is there's some inconsistency in the physical cards being sent to patients. So we all get the paper, right, where we print it out and we give the patient the physical card. We sign the back and keep that as part of their medical record, and the language says the same. This goes to the patient and this is retained with their medical record. A lot of patients show me their cards from years prior, and they have a white PDF, not on state paperwork, that they've been issued as their medical certification card, or they've got something from California that says they're certified as qualifying for a medical card, and that's all they've gotten because it's an out-of-state company writing medical certifications in Maine, and then they can't buy anything with it because they've gone through that process of paying for it, but the stores know they can't accept something like that. Or the patient has the entire form, like they bring this, they've got the whole form with them, so the prescriber didn't keep anything on file. So there's some inconsistency in the physical cards as well. So I don't know if there's any way to sort of do a little better education for the people that are getting the card, or better instructions for folks about, it's written right on the back of what you send us. But there's a lot of inconsistency. I have to tell you, I see several a day that have gotten the wrong paperwork.
I think, I mean, that's a good flag. We haven't really heard that. It's pretty clear, but I think that could fall into the bucket, both of the provider education, the patient education, those resources that we're going to give, just clear instructions. So if they're ever in the instance, at least one of the individuals understands the process, so the patient can correct the provider can correct the patient.
Yeah. And the storefronts are very good when they recognize this is not the right thing, at letting people know. And then it goes back to the patient then trying to be able to track back down the person they got the card from, and having that onus of follow-up. And so I don't know if there's any process in place where folks who are given access to certification paper and able to write the medical cards, the provider perspective, is there any sort of follow-up that happens with the Office of Marijuana Policy with us to make sure that we are following the rules, and that we do have a physical location, or that we do have the documentation that is required, that we are doing the right assessments on patients before we're giving them the cards, and we have documentation accordingly, as opposed to just, I hear from patients sometimes, all I have to do is call, I pay the $80 or whatever it is, and they mail me a card. Nobody ever asked me all these questions before. And I know that's not the norm, but is there any sort of process in place, or does there need to be, so that there's more uniformity in the process of getting a medical card as well?
I mean, certainly there could be things that are instituted to bring a little bit more integrity to the process. It's kind of a weird dynamic relationship, understanding our lanes, and we are not the experts, and the providers have their own licensing and licensing boards that they're held accountable to. Certainly it can be cleaned up and done better. And I think this is just part of that process for sure.
And if you had, maybe there's a role that could be created with somebody who understands that process and can do some inspections or some education. Maybe that person could be the same person that does some education or creates that educational module, as well as does some follow-up to make sure that people then that are getting the certification papers and are writing the cards are doing the right thing. You know,
Yeah.
maybe that's a job or a role that could be created.
Listen, well, yeah, we'll take all the help and resources we can in-house with this for all this stuff for sure.
Yeah, it's
Sure.
important. You know, patients need to make sure that they have that they've gotten their full benefit. If they're going to be certified, they need the education to make sure that they're using it appropriately. And the people that are writing the cards are that person that can help them with that. So they need to be educated as well.
Absolutely. Well, a lot of great feedback, a lot of great suggestions, a lot for us to think on, and hopefully some of the working group members watch this and we can put a bow on it and start some of this important work for sure.
Good. Okay, great.
Do you have
Right.
anything else? I don't want to, I don't mean to cut you off.
No, not immediately. And I know we're over our 15 minutes. So I'll email you my education sheet. Who should I
Yeah.
email it to?
You can email it to David. That would be great. That way we can share it with the group, because like he said, we'll put this up online so everybody can see it. Some of the suggestions and feedback and some of what we might be considering moving forward. But yeah, I certainly think it would be beneficial to us to see that, to get a sense of what you're doing, and I'm sure others are doing, if we're going to end up providing some of those resources in a centralized location.
Yeah. Okay. And I'll see if I can find any that I've gotten from other folks. Or if I can figure out who else might have some that I can share, so that there's a couple of examples.
Absolutely. Yeah.
And you know, mine could probably be improved as well. So I'd love to have feedback on the things that are, you know, not 100% perfect. So okay, good. Yeah,
Sure.
happy to do that.
Perfect. Well, we certainly appreciate the time.
Likewise, I appreciate you. I'm glad you guys are. I appreciate that you guys are looking for this feedback and allowing us to have input. So appreciate it.
Yeah, not a problem. And we look forward to, what is it, 2 weeks now, or less than 2 weeks, at the 4th meeting.
Gosh. Okay. Good.
All right. Take care, Julie. Thank you.
Thank you both. Appreciate you.
Bye.